Peptic ulcer bleeding is the most common source of non-variceal upper gastrointestinal bleeding. In this patient, an ulcer with an adherent clot was found in the duodenal bulb. An adherent clot is usually defined as a clot resistant to forceful irrigation or suction. Ulcers with an adherent clot are classified as 2B ulcer according to the Forest classification. These ulcers are associated with a rate of rebleeding above 20% if endoscopic treatment is not performed. Before proceeding to endoscopic therapy, it is important to check for other bleeding sources, and gastric biopsies should be taken as part of the investigation of possible H. pylori infection. Regarding treatment, we recommend quadrant-wise injections of aliquots of 1 milliliter of diluted adrenaline. When injecting diluted adrenaline, the needle is inserted about 3 millimeters from the bleeding point in order to avoid intravasal injection. The total volume injected depends on the type of ulcer. In most ulcers with an adherent clot, injection of a total volume of 5 to 10 milliliters of diluted adrenaline is sufficient. By contrast, injection of a total volume between 13 and 30 milliliters is recommended in ulcers with active bleeding or a visible non-bleeding vessel in order to decrease the risk of rebleeding. Injection of more than 30 milliliters of diluted adrenaline is not recommended due to increased risk of perforation. Following injection of diluted adrenaline, most clots are easily removed using irrigation, suction, a biopsy forceps, or a snare in case of larger clots.